Welcome back to our live program on World Cancer Day. My name is Nicole Engelbrecht and I'm the Head of Communications and Marketing for UICC. On World Cancer Day today, we're celebrating the remarkable progress that has been made in the fight against cancer in recent decades. And at the same time, we want to highlight the barriers that millions of people face at every turn, every day, when seeking life-saving cancer care. Joining me now is a passionate cancer advocate, Benda Kithaka from Kenya. Welcome, Benda.
Thank you. Thank you so much for having me, Nicole.
Benda is the Executive Director of Kilele Health Association, which is a patient advocacy organization and also a UICC member that focuses on improving the quality of life of cancer patients and their caregivers. Benda, Kenya has seen a big increase in cancer cases in recent years and also an increase in cancer mortality. What are the biggest challenges in facing that situation and also the biggest care gaps in Kenya?
Well, Nicole, as you rightly put, we do have quite a bit of challenges when it comes to cancer care in Kenya, but we've seen quite a bit of tremendous improvements in the recent past as well. So if you were to think about the increase in cancer cases, it's also because of the increase in the awareness, the increase in the investment in the technologies that we're using to make sure that we're getting more people as early as possible. But challenges abound. One of the biggest challenges being awareness at the community level, and therefore being able to engage people to come to access cancer care in the facilities. And this is further made even more serious by the case of where we get many people going to the facilities for screening or for early diagnosis, but they take very long to get their results back in because of issues with the lab network or issues with the number of people that they have to see before they are actually diagnosed for cancer. So you could find a woman comes to the facility early, but it takes about 6 visits before they get the diagnosis. And that delay is quite serious for people in Kenya. The distances people have to seek care, the time it takes for them to get from the periphery in the village to get to the town center where they'll get cancer screening or they'll get the treatment modalities. If you're familiar with Kenya, you would know that majority of our cancer centers are concentrated in Nairobi, the capital city, but also we have a few others in various other cities, but not necessarily at the periphery. So that's yet another challenge that we face in Kenya.
And what do you expect from the government to solve this problem? What are the policies that you would like to see changed?
Our government has been very responsive. I must give credit where it is due. Like even today, we have the government of Kenya is launching a cancer center in Mombasa, which will mean then the people in Mombasa County will not need to travel all the way to Nairobi, or as has been the case in the past. And this has been continuous improvements by the government of Kenya in embracing a decentralization of the treatment facilities to the different places that we have in the country. But what I would want to see more of and what we are advocating for right now is easier access to care. And I'll define that by government dedication of resources, both fiscal budgetary allocations, as well as allocation of human resource capacity to be able to meet the need for cancer screening, for cancer treatment, for diagnostics, and even when we talk about for post-treatment reintegration into the community, there needs to be enough resources dedicated to this. And secondly, in dedication of resources and allocation of budgets in the government annual budgets, we need to see more of dedicated resources for awareness and education. Remember, I mentioned one of the challenges we have is awareness and education. And we cannot rely on the NGO sector alone, or we cannot rely on one sector to be the one that's meeting the needs for education at the community level. We need higher level resource allocation for us to be able to make headway. Thank you.
And what is your organization doing to close the care gap and to make your services more equitable?
So Kilele Health is formed on the premise that we want to do as much as possible community engagement and a specific type of a community as well. We work very closely with cancer survivors and their caregivers. And this is deliberate because we want to engage survivors as a link to prevention. How so? If you think about cancer survivorship, people have gone through the cancer journey from finding out about the signs and symptoms or even getting diagnosed before they knew they had signs and symptoms to getting treated at the facility, to having all these barriers that we talk about as challenges for getting access to care. They've already experienced them. And then they've gone ahead and gotten treated. Majority of our cancer survivors are treated in Kenya, and they have the lived experience of where the system is serving them, where the healthcare system is working, where it is not working, what improvements need to be done. They also have the lived experience of the financial challenges that they face, and therefore they know already how to navigate this. So as Kilele, working with the survivors, we are harnessing that power of the survivor. We are equipping survivors with skills on storytelling so that they can tell their stories of impact to influence the community. We're equipping them with advocacy skills so that they learn how to talk to different target audiences, be it a policymaker when we are demanding for resource allocation, to the community level when they are asking that please go get screened because my life story should not be yours. Utilizing that powerful voice of the survivor is very critical to winning the fight against cancer in prevention. Thirdly, we are also focused on research because we know data informs decision-making. If we're going to ask for data, for funds, for example, we ought to be able to say, this is the target audience that we ought to be reaching, this is how much it's going to cost. And utilizing research as a tool to inform decision-making means our government can plan longer term. And lastly, we look at it from a point of inspiring hope. And that's what UICC does as well. We look at Kilele as an opportunity to inspire others to realize you can do anything if you set your mind to it. We are the team that climbs Mount Kenya every year with cancer survivors. People who have already been told you cannot do it, and then they come and actually prove they can do things that others who have not gone through the disease can actually do. So far, we've done two cohorts of mountain climbing up Mount Kenya. The team challenged me that we should do Kilimanjaro this year. So we're doing Kilimanjaro and also doing Mount Kenya as well in September. And that's going to be quite an inspirational thing for us to show that beyond the cancer journey, beyond surviving cancer, cancer survivors are able and capable to be equal and able contributors to the economy and also to contribute to the prevention journey. That's what we're doing.
That is so inspiring, Benda, and I believe that's also where your name, the name of your organization, Kilele, comes from, which means in Kiswahili peak or summit. So I think it's a very great name for an association like yours. You mentioned harnessing the power of survivors. You mentioned the importance of collaboration and awareness raising. How can a global movement like World Cancer Day help with that?
Well, I'll tell you, the reason we were very delighted to join the World Cancer Day and we are part of the UICC network is because we recognize the power in numbers. Like today, we spent the whole day watching, listening from different parts of the world, hearing what innovations people are doing, what work different organizations and individuals are embarking on. We've also spent the whole day discussing what are the challenges, and we get to see that our challenges are not unique to ourselves alone. Others are also going through the same, and they're able to overcome this way. In cases where we see disparities, for example, where we start thinking about gaps in care, or we start thinking about distance and geographical location as a gap, we also have to reflect internally and start thinking, World Cancer Day is a global movement. We are on a global platform. People are talking about issues in northern Northern America, Southern America. We have people talking from Asia. We have people talking in Africa. All these gaps, if we brainstorm together, we're able to find solutions together. But secondly, the power in numbers comes in when we do advocacy. Sitting on a global platform like this, it's quite an honor, but it's also a call to action to all the others who are out there doing advocacy, that we are telling each other we can be able to do this. It is not above us. And the World Cancer Day gives us that opportunity. It also gives us the opportunity for a 3-year call to action to be able to track milestones so that it's not just a one-day affair. We're looking at longer-term improvement in closing the care gaps, but also in bridging the disparities that we see, learning best practice from each other across the globe. And that's what the power of UICC World Cancer Day is.
And looking even further into the future, what are your hopes for cancer care in Kenya, let's say in 10 years' time? Where would you like cancer care to be in Kenya?
Of course, the first thing for me is the HPV vaccination, that we reach the 90% target by WHO. That would be a brilliant, great milestone against cervical cancer. And that would also strengthen the system for further impact on the country in terms of even the screening programs, even the activities around strengthening healthcare and health access for women. But secondly, Kenya has amazing policies. We have great commitment, political goodwill. My hope is that as we go along, there will be increased budgetary allocations to match the need. Budgetary allocations to match the need, so that as we do advocacy, we're able to reach as many people as possible.
Are you working together with other organizations in Kenya, and do you collaborate on these objectives?
Sorry, I seem to be losing you.
I believe we have lost Benda. Can you still hear us? No, I think Benda can not hear us anymore. So Benda, I will call you afterwards, but I would like to thank you so much for joining us today, and I would like you to, oh, I think you're back.
Yes, I'm back.
Are you back? Can you hear me? Okay, good. So I have time for one more question, Benda, but I was already about to thank you for all your inspiring work. I was going to ask you whether you collaborate with other organizations in Kenya, in Nairobi, and join forces with them on this work.
Yes, definitely. We are members of the NCD Alliance, and that is one of our key collaborators in Kenya. We are also collaborating with the government of Kenya, both sitting on technical working groups, as well as representing the voice of the community in different forums, where we're able to give input, both technical as well as socio expertise in community outreach. We also collaborate with a university. We've just signed an MOU with a university to do research on stigma for cancer survivors. And this for us is a big milestone because it's part of the work, the mandate that we have to contribute scientific data into the longer term cancer management, cancer control, and survivorship reintegration into the community. We also collaborate with various other organizations, for example, Hope for Cancer Kids. Our role as Kilele, we see ourselves as being able to link with others who have different strengths. We do not believe in doing everything. And so working with both private sector as well as public sector and government sector as well, working with NGOs, we collaborate because we can't be everywhere at the same time. Our strength lies in networking, collaborating, both with patient organizations, as well as with the government policy-making agencies, and as well as with other key players such as the pharmaceutical industry. For as long as we have cancer as a burden in Kenya, all hands on deck, everybody has a role to play, and we are keen to collaborate and partner.
All hands on deck, you're saying, and I really enjoy your positive outlook, and there is so much to do, but a lot of progress has already been done, and your symbol, or the symbolic name that you have, Kilele, which is so powerful, is really encouraging, because we know that mountains can be climbed, mountains can be conquered, and so can the cancer burden. To finish off the interview, could you share a few encouraging words with people living with cancer and their caregivers who are watching us now?
Well, this is so coming from the name Kilele, which means reaching your peak or reaching your optimal. We are forever hiking. And when we go, one of the things that we say is your Kilele is your Kilele. Looking at what others are doing, it's easy to be discouraged, because then you would be saying, oh, I've spent so much on finances for cancer treatment. I have all these issues with acceptance of even personal body image, as well as personal challenges that come after the treatment. Or probably I'm facing this and that and the other problem coming from the treatments. For example, even lack of sleep, insomnia, because of some of the interventions that have been done is real. But what we've realized with the Kilele team and as we are hiking is baby steps. You cannot climb a mountain by running up the mountain in one go. Like tomorrow we'll be on a mountain, it's called Elephant Hill, and it takes 7 hours to 10 hours of continuous walking. But in that continuous walking, we're able to conquer. The same with life. We cannot congregate everything in one go. We have to think about how do we take everything in baby steps, one piece at a time, break the goals, make them easily achievable. And before you know it, you've reached your Kilele. We wish you the very best. We know it is doable. And even when you have summited, use that knowledge to inspire others. I am daily inspired, daily encouraged by the people that I work with. They are amazing humans who have amazing compassion, amazing joy, and amazing appreciation of life, because once you've gone through a cancer journey, everything else makes sense in the sense of appreciating life more. So keep inspiring us, keep fighting, keep encouraging others to also overcome, because all of us together will win together. Thank you.
Thank you so much, Benda, for these powerful words. Thank you for joining us today, and good luck for all the great work you're doing.
Thank you so much for having me. And thank you to the UICC team and World Cancer Day team putting this together. This is all also great. We've learned so much. Thank you.